Welcome to VMC. I'm Dr. M, and we're going to cover a recent survey that was done about general practice veterinarians who are not in a shelter environment and how they feel about behavior and how comfortable they are with addressing it. So join me, you'll learn something. So the data that was published was based on a survey of 59 general practice veterinarians who are not in a shelter medicine environment. And this survey had the purpose of looking at how those GP veterinarians feel about behavior and how comfortable they are with their knowledge base of it and how they feel about trying to address behavior concerns while in their day-to-day work. Now, admittedly, this is a pretty small sample number. Ideally, we would see a lot more than this, but the information that was found is still worth discussing. So we already know from other data that euthanasia due to behavioral reasons is the most likely reason for a young dog to die. This is more common than death from diseases like parvovirus, etc., which is why in my video on socialization we discuss what the current best practice is as far as getting your dog the best start to life possible. Anyway, this survey found that follow-up for behavior cases is worse than follow-up for physical medical issues. It was also interesting that the longer a veterinarian had been practicing, the more likely they were to view behavior concerns as a welfare issue, and they most definitely are. Mental suffering is just as valid and just as real as physical suffering, and the way an animal is coping with their day-to-day life or their ability to enjoy their life and be a dog or a cat is a very important part of their quality of life. Now, part of what made me a little bit sad is that about half of the people who were surveyed are not comfortable discussing behavior issues when they have a patient in their exam room. And they were saying that this is because they feel they do not have enough of a knowledge base to be addressing it. 80% of the people surveyed felt that their vet school education had poorly or very poorly prepared them as far as behavior goes with what they would need in general practice. There is truly no veterinarian that is up to date with every single realm of every piece of veterinary medicine. That's just not possible to do. And so you are going to have some veterinarians in the general practices that are better and more current with their knowledge base of behavior than others. I am a GP who is very interested in behavior, and I did go to a vet school that offered a 2-week internship that focused on behavior, where I got to work very closely with a boarded veterinary behaviorist, and I learned a lot in those 2 weeks of clinical practice seeing behavior consults. And I have done hundreds of hours of continuing education in the land of behavior after graduation because I quickly recognized how behavior is linked to essentially every single visit that we see in general practice. Just a lot to learn in the world of behavior, and not everybody has that time, not everybody has the interest, not everybody has the want to do that. And so it's very important that as general practice veterinarians that we have people that we can refer clients to. The fact of the matter is, I don't have the time to hold a weekly class or one-on-one sessions or go to people's houses to do these sorts of things. But skilled positive reinforcement trainers, that's literally what their job is, and they're very good at it. And I can team up with them to provide excellent care for patients. And so one of the first things I do if I ever move to a new location is I go and I audit some positive reinforcement puppy classes, and I get to know the people a little bit, and then from there I can know, okay, if I refer people to this puppy class, to this kitten class, they're actually doing a good job and doing work that is at the current standard of care. I really, really want to set my patients up behaviorally for success. And it's also important that if there is a case that is a bit more complex, that a trainer needs additional help with, then we really do need to work with veterinary behaviorists. They have so much additional training, as I've covered earlier in previous videos. They might have additional ideas or medication combinations or other knowledge that I just don't have as a general practitioner. And they can also help by working with a trainer on management plans and behavior modification plans and how to implement those. And so there are cases where a veterinary behaviorist is needed. I'm very passionate about this. It is near and dear to my heart, but I know that not every veterinarian is. So it does lie on you as the person who has these pets to make sure that you are working with a team of people that can best help your animal. So your GP veterinarian has tons of incredible skills, and then you need to add to that team and have a skilled positive reinforcement trainer to help with teaching husbandry skills, cooperative care skills, reducing stress for going to the vet clinic, but also working on things like loose leash walking and other behaviors that require an individualized training plan and someone to work with you to help you with your mechanics and to problem solve as things pop up, to be a bit of an accountability buddy as well, and then to provide a learning atmosphere where you can learn how to modify behavior in a way that is ethical and science-based. If you'd like more information on positive reinforcement, I have covered that in a previous video. I'll link them all in the description. I've also covered punishment and dominance theory because there are so many myths and misconceptions that go around about these things, and there's still a lot of very outdated knowledge out there. So while we're waiting on, the knowledge that research has given us to kind of disseminate down into younger generations, it's important to have a team where you have a general practice veterinarian and you have a positive reinforcement trainer. Both of those people paired together can do wonderful things for the welfare of your animal. Well, I shall leave you with some lovely footage of my dog enjoying some wading and some swimming time, as we have been in the middle of a heat wave for the past week, so she's gone swimming every day to try to help keep her a bit cooler. So I hope you enjoy this dog joy, and I will see you next Friday. We'll post a new video most Fridays. Bye!
Good job! Nice! Good job, Boo-Boos!